Professor Michael Freibe, who is an expert in diagnostic imaging, image-guided therapies, exponential medicine, and healthcare innovation generation. He is a founder, innovator, CEO, investor, and research scientist at IDTM, Germany. After a BSc in electrical engineering, he has spent 5 years in San Francisco as R&D engineer at a MRI, and ultrasound device manufacturer. At the same time, he graduated with a MSc in technology management from Golden Gate University, and back in Germany, obtained his PhD in medical physics from the University of Witten. Professor Freibe currently is a research fellow of Technical University of Munich, an adjunct professor at the Queensland University of Technology, a guest professor at AGH in Krakow, and a professor at the Healthcare Innovation at the Medical Faculty of Otto von Guericke University in Magdeburg, Germany. He is a listed inventor of more than 100 patents, author of more than 300 scientific contributions, started over 25 medical technology startups. He is a board member of 4 medical technology startup companies and an investment partner of a medtech investment fund. He is an IEEE senior member and a distinguished lecturer of the EMBS Teaching Innovation Generation from 2016 to 18. He has also oriented medtech translation, entrepreneurship from bench to bedside, especially in combination with exponential technologies, and also by employing interdisciplinary approaches within an ethical and patient benefit-centered environment. Today, Professor Freibe will be talking on the topic sustainable and disruptive health tech for India and world. Over to you, Professor Freibe.
Thank you very much for the introduction, and I'm extremely honored to be part of this. Particularly the topic AI for social good is actually, certainly fitting my understanding and my research perspective and my goals in future development. And health, I think, is a very important part of social good. So let me share my screen. You should see my screen, I hope.
Yes, sir.
Yes, all good. See. So the topic has been said. There was also a nice introduction on sustainability, and I think sustainability in contact with health has a completely different meaning. And there is much more to it than talking about healthcare. There is a much more important facet that deals with health and maintaining health. And I really believe, and that's why I put this in the title, that India could be a leading institution, force, country that actually provides innovation in that context. In certain aspects, we are in the developed world that I am coming from, that I'm based on. We're a little stuck, and we are stuck in a setup. And I think we need to have certain amount of disruption. So if people don't know what disruption means, and I'm adding another word to it, it's called intentional disruption. So we want to actually change something. It is something that has to do with providing an output and information and projects and tools that improve things by a factor of 10 or more, not just 10%. That's what we typically do. We do a little bit of an incremental innovation, but something massive. And I think massive is needed to actually deal with the unsocial aspects of health that we are dealing with. So just a quick one, and I think that's all known to you. We're in the 4th industrial revolution. However, medicine is pretty much stuck between the 3rd and 4th. We're still teaching the same things than 30, 40, 50 years ago. We're not really employing technology and the goods of technology in healthcare provision. So there's a lot to be done, and a couple of the reasons why we are at that point is because we're dealing with a human being. We're dealing with health. We're dealing with potential, very critical aspects. So everything is double, triple, quadruple safe and quadruple regulated. And I'm not saying that is bad. I'm just saying that is one of the reasons why we're extremely conservative with respect to healthcare. So The SDGs, and they are mentioned, they're part of this symposium, and I'm very, very happy to be part of this. And I'm very happy that this is a topic of a symposium where you use AI for social good. And AI, at least to my understanding, is a tool that helps achieve certain things. It's not that you look at AI, you should look at the problem, and you should look at what can you reach, and is AI a tool that helps to achieve that? And I certainly believe in healthcare it is the case. So what we have to see, however, in the sustainability aspect, which is also a part of this topic, is there's a lot more to health than just providing good health care. There is an environmental responsibility that we have: good water, good air. We need to provide this. We need to also make sure that people have a certain amount of economic stability. Poor people, as we know, have a significant reduced life expectancy, have a significantly reduced health than compared to people that have a good economic standing. And there's many other things. So healthcare is only a small part, and I have a chart on this one later on. So we are currently in healthcare focusing on diagnosing and treating in case of sickness. So that's why very often people call healthcare not healthcare, but they call it sick care. You go to the doctor when you're sick. You go to the hospital when you have something to be treated, to be therapied. But shouldn't we actually focus on things like prevention? So that we don't get sick, that we don't have to go to the doctor, or only in very urgent cases, or maybe for follow-ups or monitoring. So we need to focus, and that also should be our activities in development, on predicting when things happen to prevent diseases from happening in the future. And we need to obviously move to something else that is called precision medicine, patient-centered medicine. So not the patient is running around and trying to get the treatment. The treatment is basically focused around the problem of the patient and puts the patient in the center of the attention. Not the case in most healthcare systems. Actually, I would say probably in all healthcare systems at the moment. Now, if you really think about this and think about on whether that will happen, and just assume it will happen, prediction, prevention, people will not go that often to the doctor anymore, will not maybe need that often a hospital anymore, maybe have a higher longevity, will live longer. That will have a huge effect on future business models and innovation models. And we need to consider that for also our innovation activities in the future. And I think cost, and that's very often underestimated, cost is a major driving force for innovation. And if you don't put cost in the forefront of your attention, in the forefront of your innovation activities, you probably will still do only what we call incremental innovation. You make things a little better. Not saying that that's wrong. That's a good thing to do. We need to always improve things. But to really get to a completely different way of health provision, we need to think a little bit more disruptive. So, and that cost is a driving factor. So I believe, and there's other people who believe that too. It's not my chart. I stole some of these presentation documents here. Is we'll move to a P4 medicine. So we will predict, I mentioned that already. With that, we hopefully prevent diseases from happening, prevent us from getting sick. We'll have to have a personalized approach, not an approach where everybody is kind of like treated the same if you have a certain disease pattern, but it's personalized to you. It's personalized to your specific problem. And of course, we need to ask the potential patient, the participant in health, to actively participate. Think about the food intake, activity level increase. All these kind of things contribute to a sustainable health model. And the aim of a developer like me, I'm an engineer, should be that we, of course, create better outcomes, but we improve and think very clearly about improving the clinical and the patient experience, and we reduce cost. And I will focus one more time later on why cost, to me at least, is the most important aspect of innovation in that space. So a quick look on where we believe healthcare will be delivered. And it will not be anymore at the doctor or the hospital. Healthcare will actually be delivered, possibly to a large extent, anywhere you are. You may have a tool with you, maybe a cell phone that helps you, or a smartphone. You will do it at home. Smart monitoring at home, health monitoring at home, data gathering at home, a very important aspect for AI. So the actual healthcare delivery will be shifting from where it is at the moment. So the health determinants, and that's an aspect that I think we should very, very strongly consider, is the social economic factors. So where are you living? What is your education level? What family are you in? What is your income level? And there's a lot of other aspects of socioeconomic aspect that actually do have a huge effect on your health and have a huge effect on your ability to stay healthy and to have a long life. You see, there's a huge discrepancy between the top and the bottom 10% of the society with respect to their socioeconomic capabilities. 20% are dependent on genetics and biology. Certain things are not changeable at the moment, but possibly they will with genetic engineering. Not sure that that is something that we want to get into also from an ethical point of view. Of course, we know, but we don't always follow that individual behavior patterns and the way you eat, what you eat, how much you eat, what you drink, maybe use of drugs, tobacco, alcohol, lack of exercise or exercising has a traumatic effect on your health standing. And that the environment you live in also has something. If you live in a city, if you live in a rural area, if the air and the water are good, all these kind of things, and only 15% are actually are caused on the whole determinant side by the actually healthcare provision. That's pretty low. But we invest all our time and effort in that. So shouldn't we actually invest it more in the other ones to make sure that we have a healthy and good life? And I think we should. And we should probably put some of the money and some of the efforts that we spend in healthcare provision to the other aspects. So I just looked a little bit at India, and I have a very long and intensive history with India and healthcare provision in India. I think it's an absolute amazing country, and I think you have amazing people there, and you will have the opportunity to probably do more for the world. So let's start with what is actually not good in India. So one of the things that I believe are not really working well is a relatively uneven, unfair access to healthcare. So if you live in the city or you live in a rural area, you may have different access to specialists, to equipment. It is rather expensive, and again, focusing on cost, expensive means if you reduce cost, it may be more accessible to more parts of the population. You can get anything in India, and you can get any treatment in India as long as you have enough funds, and as long as you live in an area that has these systems and this expertise available. You have this discrepancy, I mentioned already, between rural and urban, and you have an issue with staff and education. You know, you may educate, and we do that actually in other countries too. We may educate wrongly. We may educate not concerning or with respect to the innovation potential. What is the advantage, though, that you have? You have a clear need and low barriers of entry. What I mean with that is you are actually going for what you need, or you could go for what you need, rather than having established structures that you have to deal with. Technology adaptation, and I have a chart on this one, is higher even than in most of the developed countries. You have a much steeper increase in longevity that you have reached because you have done more in these health determined segments that I mentioned before. And you have a lot of opportunities for home care and self-care. So these are some advantages you should take care of and you should take advantage of. Now, COVID and other things have done a lot to digital healthcare in the last year. All these things that we expected would never come or would come in 10 years basically happened overnight and in a few months. And we have, even from the previous American administration, seen that telemedicine was considered an important task. And they introduced some of these things. And what you have seen here is the decrease of actual physical visits and the increase of televisits. And that's about a year old, these numbers, and that has gone up even further and has maintained it. It's not gone back. And we need to really see the benefits of that pandemic situation too, besides all the negative stuff, which I obviously am very sad of. But there has been, at least to the digitization and advancement of digital tools in healthcare, has been a huge, that pandemic has had a huge impact. So, however, in a lot of countries, we're still far behind. There's a lot of blockages to adapting digital technologies, adapting AI in that respect too, because they are very critical, the doctors. They're very concerned, they're very conservative, they don't put trust forward. I think that's one of the things that was mentioned before too. Trust is an important essential with respect to using technology, with respect to actually implementing AI in the actual practice. And quite honestly, it is very difficult, even for me sometimes, to explain what happens in this AI. And that is a very important thing that we need to discuss and make sure of. So we need to move, however, from just a mere provision of an analog service that is digitized, or a service like telemedicine, where we just basically replace the travel component, but you still see a doctor on the screen. We need to replace that with a telehealth, where we take advantage of the digital opportunities and the digital advantages that that AI and other connected health firms will bring. And that is the important task that engineers, together with clinicians, there's always needs to be an interdisciplinary approach, need to do and need to achieve in the next years. And even the big companies have seen that there is a continuation in the pathway of treatment. It's not only doing the therapy, and but it is also something where the digital information needs to be collected in a preventive case, needs to be used for predicting, and then it actually once you have been treated or diagnosed with the disease and you follow up on a therapy plan, it is all the data is collected and is used to improve the future strategies, the future therapies, and also helps to further predict things that will happen with you. And we will have an empowered patient. I'm pretty sure on that one. So people will actually use tools at home and will use tools to monitor their own devices. And even the FDA, this is the chart from the FDA, has seen that this digital health creates completely new channels and completely new approaches with all the sensors you can wear. I have a sensor on my arm here that measures all kinds of all kinds of things. We will get to a point where we will have a completely different setup at home than we have at the moment. And we need to manage these data points interconnected. So that is also a very important task of engineers and scientists, to put these data points together, have exchange capabilities, and have capabilities to basically make sure that we use the data points to predict things from happening, have some analytics behind it. There is a lot of things still to be done, but there's huge opportunities in this one. So interesting enough, that's what I said before, India is actually much further than some of the countries. I'm coming from Germany, so we are way behind. I mean, India has a double usage of actually using digital health apps. And it's based on need. If you don't have access to doctors, or it's difficult or expensive to doctors, you use tools that are available to use, and digital tools could be a replacement or at least an add-on tool. Now, what we do in innovation design, and that's something you are a university, and it's basically an education system that you represent. We need to follow up on actually understanding problems that we can solve and then potentially intentionally disrupt. And this is a design thinking approach that we should always follow also in education. We should have empathy put forward to the patient problems, to the clinical problems, define ideas, iterate with them, come up with prototypes and test them, and maybe then implement them in form of startups or other things. And interesting enough, if you don't do that, you'll come up with that. What experts think is completely different what healthcare was actually need. So very often, if you have an engineering-driven approach, we develop the wrong things. We develop not what is really needed out there. So we really need to focus on the points that are needed. Interoperability. We need to make sure that there's a good user interface around, and just having a digital tool that is not attractive and not providing a solution is not a real good advancement. And we should actually focus not only on improving what we have at the moment. This is that incremental innovation that I mentioned several times, but we should focus on the big issues. So if you have these chronic conditions that are driven by these risk factors, and we would be able to actually solve those or control them or better monitor them or have an advanced treatment for them or a prediction model, we could reduce cost and chronic illnesses dramatically worldwide. And that's actually some of the things that we probably should put some effort in there as well. So what will likely happen, I think we'll have a lot of the tele technologies, medicine, consulting, manipulation. But we have in the medical field, you know, that we have a very high regulatory hurdle that we need to overcome. And but I think I'm pretty sure that we will get that done. We'll need personalized and value-based medicine. So actually not only having something, but actually measuring and being sure that there is a real value provided by that. And we will have certain exponential growth in wearables, health sensors. And for that, we need 5G and other technologies that actually make sure that the data transfer is done in real time. So I'm also mentioning one more time the inequalities that we have and some of the things that we need to address. A quick example that we have done, or we wanted to get done with the IIT in Kharagpur, was actually thinking about an AI intelligence-powered e-doctor, and that was basically addressing the rural and urban issues that we have. Basically, you know, the lack of accessibility, the lack of doctors that are around, the lack of proper diagnosis. And we propose to use a truck system that integrates robots, AI analysis. So there's not a doctor on board, but there is all kinds of tools on board. And you need to, you know, before you get actually treated, you need to start with a base statement, and then you regularly checked, and then people can immediately see whether there's something wrong with you or not. So to use the device like that in combination with remote capabilities to address future prevention to address future prevention capabilities, and to make sure that people are also treated very well in rural areas. And from the education point of view, I think we need to focus, and from a technology point of view, we need to focus on using some of these exponential technologies with the goal to do effective treatments, cheap treatments, easy to use ones. The more complicated, the less accessible it is, and the more expensive it is, the less accessible it is. It needs to be small, portable, and all these things can also be done for existing workflows and approaches. And that's an important thing. Not only look at new things, but also look at how can you improve existing setups. And there will be dramatically new business model with that. I have no idea how they will look like, but if you do these kind of disruptive changes, they will always lead to a different business model. And business models are important because at the end of the day, we need to be stimulated to develop these things. We need to be stimulated to use them. And the dramatic increase in efficiency that will provide will actually cause a change in education and other things. Talking about educations, we need to ask ourselves, obviously, also all these questions, and questions lead to answers. Questions are more important than answers. You may know that. And so we need to answer ourselves the questions: how do we achieve these things? How can things actually be used to not incrementally improve, but make things accessible for everybody? Maybe even do some social questions. Should actually healthcare be a business or not? These are all important things, and they provide huge international opportunities. And I think India is very capable of being the leader on this one. So, and I'm finishing up now, and I just wanted to clearly say that I believe the education system needs to revise too. We need to not only go in depth, we need to go in the horizontal. We need to be able to teach soft skills, 21st century skills. Entrepreneurship is a big issue. Innovation skills, learning skills are a big issue. And a lot of universities don't do that. At least in my area, I can say that we are very siloed. Electrical engineering is electrical engineering, mechanical engineering is mechanical engineering. But for solving problems in health, we need to have an interdisciplinary approach with clinicians, economists, and engineers. And we need to use all kinds of innovation tools that are available to actually dive deeply into the problem, analyze the problem, ask a lot of questions, and then come up with good solutions. So developments will be much faster in the next 20 years than they have been in the last 200 years. I think that's a clear statement. I believe also that a lot of the healthcare will shift to home care and will shift to prevention. Please work on this. I think it's an incredibly great opportunity for everybody. There's entrepreneurs needed that actually take these challenges. And we also have massive opportunities for everyone in this aspect. I think healthcare in the developed world is something that will improve significantly faster than in the developed world. And with that, you'll have huge reverse innovation capabilities of bringing technologies you did develop in India back to the developed world. So think exponential. Thank you very much for your attention. And I hope that it was a little bit stimulating.
Thank you, Professor Frebe. We have a lot of research that is directed towards health and well-being. Definitely a researcher like you will be a great motivation for us. Thank you for your time, sir. We thoroughly enjoyed this session. Thank you once again, Professor.
You're welcome.
That marks, yes, sir.
No, you're very welcome. That's all I said.
Okay. That marks the end of the opening session of the day. Once again, I'm thanking our guest speakers, Professor Sriram Devanathan and Professor Mikhail Frebe. It was a wonderful opening we had today. We are sure that all the attendees might have gained valuable insights of the talks we had in our opening session. We will now have a break. We'll resume with the next session at 3:10 p.m. IST. We have more experts talking that will be covering the thematic areas, AI for autonomous vehicles and AI for health and well-being. And there will be featured